Hello, I'm Dr. Dennis McKenna, and I'm reaching out with an important update about nursing at Albany Med. With over 1,800 nurses, your role is vital to our mission. As we approach Nurses Week in early May, a special time to celebrate the incredible work happening across our units, clinics, and during the Pillars of Nursing event, I've been reflecting on where we stand and the progress we've made together. We've seen real meaningful gains in recruitment and retention. In the past year alone, we've welcomed 383 new RNs, including 45 internal promotions. Dozens who had left have decided they would rather be here, and in fact, 78 nurses have returned home to Albany Med, and we're thrilled to have them back. Our turnover and vacancy rates have improved significantly. These staffing gains are making a visible impact. Fewer boarders in the emergency department, smoother patient flow in critical areas, and increased efficiency in our perioperative spaces. Our clinics are better staffed, improving operations and the patient experience. I ask you to consider, are things better today than they were 18, 12, or even 6 months ago? I've heard from many of you that you feel more supported on your shifts. That's great to hear. Are we done? Of course not. Staffing will always require effort and continuous improvement, but we are committed to doing that work with you. Importantly, these improvements did not happen by chance. You made them possible. You have helped recruit new nurses, welcomed them to your team, and driven meaningful change. Most importantly, you have stayed. Your commitment means everything. Whether we have just met or worked together for 25 years, you are here, and I am grateful. Now, I'd like to briefly address our ongoing conversations with the Department of Health. As you may have seen in recent news, the department has been active statewide, conducting unannounced hospital surveys. At Albany Med, we have had 8 visits in 2024 alone. Despite that scrutiny, we have had only one outstanding issue, staffing, from a survey that reviewed data going back to 2023. During a time all hospitals were rebuilding post-COVID. We made it clear then, and I'll say it again, we wanted more nurses, and that's exactly why we have focused so heavily on recruitment and retention. We have also asked that staffing enforcement be applied fairly and consistently across all hospitals in the state. I'm confident that we will resolve this issue just as we have others. That brings me to our labor discussions with NYSNA. As you know, we made our last, best, and final offer in early December, over 18 weeks ago. I made that offer because I believed then, and still do, that reaching an agreement gives us the best opportunity to move forward together. This contract includes well-deserved pay raises, premium pay, and additional compensation for charge duties and precepting learners. These are things you deserve, and we want to deliver them, just as we did for other Albany Med colleagues, some of whom received their increases last year. But NYSNA has not allowed our offer to come forward for a vote. Why? Because one issue, SHOP status. NYSNA wants union dues to be a condition of employment at Albany Med. Today, Albany Med is the only hospital in New York State with a NYSNA-represented workforce that operates under an open SHOP. That provision was mutually negotiated in our first contract, and it matters. Now it is NYSNA that wants to change it. So where do we go from here? Your voice matters. If you feel strongly about SHOP status one way or another, I encourage you to attend upcoming bargaining sessions to make your voice heard. See the process firsthand. I've always valued these video messages as a direct, transparent way to speak with you. But I also believe in real conversation, and I welcome chances to connect in person where you can ask questions and share your thoughts. Let me close here. This is not about Albany Med winning or NYSNA winning. The only people who should win are you, our Albany Med nurses. You have earned the opportunity for us to raise your wages and strengthen your benefits. We are ready to deliver it. Now is the time to speak up. And I assure you, we are listening.